Hello, I'm Dr. Belen Dofitas, a dermatologist from the University of the Philippines, Manila. Let me begin with a story of a forgotten disease in the Philippines. In the year 2000, I found Yos completely by chance while conducting community skin surveys in leprosy endemic villages in the southern Philippines. Have you ever seen Yos or even know what it is? I didn't either. I thought Yos had been eradicated in the 1960s, but I saw several active cases there. Only a handful of dermatologists had ever seen Yos in the distant past or even heard about it. This story exemplifies the challenges we face with skin-neglected tropical diseases. Today, I will talk about skin-neglected tropical diseases and the global challenges and solutions. I have no conflict of interest to declare. First, I'll talk about what are skin-neglected tropical diseases, what is the skin entity framework, what are the successes, challenges, and solutions. Neglected tropical diseases refer to a diverse group of mainly infectious diseases that prevail in tropical and subtropical conditions in 149 countries. NTDs affect more than 1 billion people, which cost developing economies billions of dollars every year. The worst affected are populations living in poverty without adequate sanitation and those in close contact with infectious vectors and domestic animals and livestock. Our focus today is on the skin NTDs, a group of diseases for which the primary presentations are changes in the skin, like lumps or swelling, ulcers, swollen limbs, and patches on the face or body. If not diagnosed and treated early, these can lead to long-term disfigurement, disability, stigmatization, and socio-economic problems. The skin NTDs are Buruli ulcer, cutaneous leishmaniasis, post-Kala-Azar dermal leishmaniasis, onchocerciasis, podoconiosis. The next 6 NTDs are present in the Philippines: leprosy, lymphatic filariasis, mycetoma and deep mycosis, scabies and other ectoparasites, and Yos. Only leprosy, LF, and Yos are priority diseases for elimination in the Philippines. In 2023, Noma or Cancrum oris was added to this list by the WHO. There are around 21 neglected tropical diseases earmarked for either elimination or eradication by the World Health Organization by 2030. Among the skin NTDs, only Yos is for eradication. Leprosy and onchocerciasis are for interruption of transmission. Lymphatic filariasis for elimination as a public health problem, and Buruli ulcer, mycetoma, cutaneous leishmaniasis, and ectoparasites are for control by 2030. Despite the diversity of NTDs, I came to realize that all NTDs actually involve the skin and mucous membranes in some way. The skin is either a portal of entry or exit of infectious agents, which directly invade the skin or are transmitted through the skin by vectors. Skin signs and symptoms of NTDs may be prominent, but also appear as transient reactions to infection or infestation. For example, urticaria and pruritic papules caused by helminths. Skin health is therefore extremely important for our protection against disease and for the recognition of NTDs. In 2022, the WHO developed a strategic framework for the integrated control and management of neglected tropical skin diseases. With the vision of skin health for all, the goal is to reduce the morbidity, disability, and psychosocial impacts of skin NTDs and other skin conditions through a people centered integrated approach. The integrated skin NTD platform and its approaches may also be used to address and benefit the control and management of other severe skin conditions. The journey of a patient with a skin NTD is long and entails these necessary steps before a cure is attained. But even though the infection is cleared, there may be recurrent inflammatory events, disabilities, and psychosocial problems to deal with for a lifetime. The chronicity and complexity of skin NTDs pose several challenges to their control or elimination. There have been successes in the global effort to eliminate skin NTDs. As of November 2024, the WHO reported 54 countries as having eliminated at least one NTD. I marked with a red star all the countries that had eliminated at least one skin NTD, mainly lymphatic filariasis. There are gains but also challenges that hinder the elimination of skin NTDs. I will attempt to summarize my findings. To answer this question, I searched for relevant WHO guides as well as recent review articles on this topic. I found two WHO guides, one specific for skin NTDs and the other on multi-disease elimination. I also found an article by Forbes on challenges and opportunities in the fight against NTDs 1 decade after the London Declaration on NTDs was made. Another review reported the diagnostic and treatment updates on skin NTDs since the WHO launched the integrated campaign in 2017. Aside from these publications, I sought the insights of colleagues who have worked on the ground for many years. I asked experts on skin NTDs and those working in the field to identify the top 3 major challenges related to skin NTDs and how these challenges can be addressed. I'm very grateful to the following colleagues who responded to my brief survey: Dr. Kingsley Asiedu, Dr. Paul Sanderson, Dr. Lisbeth Nires, Dr. Rie Yotsu, Dr. Vicente Belizario, Jr. I collated the information from the publications and key informants and also added a bit of my take on them based on my experiences with leprosy and yaws. I then categorized the challenges as well as the measures or solutions. I identified these 11 issues. The challenges are related to health policy, financial resources, integration, diagnostics, treatments, human resources, health information system, awareness, ethical issues, human behavior, and disease characteristics. I will summarize most of these challenges. The lack of health policies and consensus on the control and prevention of skin NTDs affects the whole program, such as resource allocation, detection, and treatment. Political commitment of the governments and clear policies and procedures have to be in place. There is a lack of financial resources and challenges on sustaining donor interest and domestic funding. Greater commitment of governments are essential. India was able to stop yaws transmission because of its government's commitment. More collaborations and international support are key to success. Difficulties in integrated approaches to skin NTDs have been encountered. There are varying prevalences of skin NTDs, and additional work is required to produce new guidance on the integrated approaches. To address this challenge, collaboration among stakeholders has to improve, and a coordinating body assigned to oversee the integration. Skin NTDs need to be mapped out to identify overlapping areas and hotspots. Other public health problems can be identified for integration with skin NTD work, such as the neuropathic foot care for leprosy and diabetics. There is a lack of accurate, field-friendly diagnostic tests to screen or confirm infection, and a lack of access in endemic countries. For example, the point-of-care serologic test kit for YOS can only be purchased from the USA or donated by WHO. Research and development of point-of-care DNA RNA-based testing will improve confirmation and drug resistance monitoring. Research on more sensitive, field-friendly diagnostics should be supported, such as the use of a portable PCR machine. We lack more effective and safer treatments, as in the case of mycetoma, and lack access to treatments. Emerging drug resistance has been detected with azithromycin for YOS and drugs for leprosy. There is an ongoing search for new drug options or drug combinations. Funding, supply chain management, and prescribing guidelines are needed. Outreach activities and awareness raising will improve access. To monitor and prevent drug resistance, point-of-care affordable PCR tests are needed. People are the most important resource, yet there is often a lack of quality personnel and training for them. Health workers are often overloaded and multitasking. Retention of expertise poses a problem when there are no young doctors to take over. For example, we consider experts in leprosy a so-called dying breed. We need innovative approaches for continuing education, such as telehealth and training of health workers. Technical officers or advisors on different NTDs can assist country programs. Persons affected by skin NTDs can be trained to help out in the control programs. We also lack updated and robust data to provide the basis for policy and resource allocation. It has also been difficult to integrate skin NTDs in the existing health information systems. We wonder how continued disease surveillance can be supported and how drug-resistant surveillance can be established in endemic countries. Many countries have unknown status of skin NTDs because these are not required in the health information system. In the Philippines, YOS became a forgotten disease when it was dropped from health surveillance after 1973. All skin NTDs should be included in national and local health information systems. Mapping of skin NTDs will guide resource allocation. There is an ethical issue that has been raised. Non-NTDs, which comprise the majority of skin problems, are not addressed, whereas skin NTDs have free treatment from the government. Health programs do not have the means to treat all dermatosis. On the other hand, if there is a broad program for skin diseases, there may be a risk of taking focus away from existing disease-specific programs and investments. So what approach would be best? We must advocate for skin health for all. For example, by addressing even just the top 10 common skin diseases of the community, there will be wider health benefits for the majority. NTD targets can also be met as we keep the skin clean, protect it from vectors and infections, and treat diseases. We face several challenges in the elimination of skin NTDs. Let's work together and aim for skin health for all. But for people-centered care, I would say, let us aim for skin health by all. Maraming salamat po.